Hello, Rebecca.
Hey there, Marion. Good to be back for our second episode in 2025.
I agree. There's a lot to talk about. I feel like we're going to be doing one of these every few days.
Absolutely. And today I know we're talking about a topic that is like near and dear to many of our colleagues, personal lives and professional lives. And what are we talking about today, Marion?
Yeah, well, for a long time, I was a resuscitation science researcher. And so, this is near and dear to my heart too, and a lot of my colleagues. But we're going to be talking about the NIH indirect cost cuts that the administration has said that they're going to try and push through. Now, there is a federal judge has blocked that for now. But there's a hearing February 21st, which is in about a week from when we're recording. So, it's still unclear what's going to happen. But if it goes through, it's going to decimate the national biomedical research community.
Yeah, and what Marion's referring to is that basically there's been an announcement made that NIH funding is only going to cover now 15% of administrative costs, with on average historically, and Marion's sharing some of the, we'll share some of the links below, traditionally have been somewhere between 27 and 28% of any grant funding could go to administrative support to launch those programs and support those programs and operational, and as high of 60% to specific organizations that are doing really elite research to basically cover those costs. But Marion, I think just all of us don't necessarily understand what that means. Like, what are administrative tasks? Why do you have to cover for administrative overhead? Because I think that a lot of people think that, this is a place that feels wasteful. So what is administrative percentages, and what do those dollars go to when you're looking at research?
Yeah, so indirect costs really are your facilities and administrative costs. So think we always say it's what keeps the lights on. It's the maintenance costs. It's electricity. It's water. It's even more than building components. It's your legal and compliance offices. All of those things that help a research institution, a research laboratory thrive. So it's not just the researchers and the work that they're doing and their staff. It's all those other things that help the research actually happen.
Yeah, and I think to your point, a lot of people are wondering where and how did this model come about? And I know you and I have done some research on it, and it dates back actually to post World War II, when after of basically World War II, there was a major understanding that research had to happen to keep developing key priorities for the United States. Now, there was a movement that part of this could be done by the federal government, that they would own all labs, all development, but they actually said, you know what, we're going to do better is if we allocate dollars for funding of research to universities where most of the researchers are, so that we can bring in a wide diversity of ideas and of abilities to actually look at problems differently. And they basically established that universities and the federal government would basically establish a 50-50 cost assessment into actually putting that research together. And that is why the model exists today. Now, what is your belief, and what are you hearing from basically universities across the country who are getting and being made aware that basically up to 50%, in some situations as high as 45% of those dollars are going away to operate the research study? What does this mean?
Yeah, I mean, it really it means so much more than just we're talking about so much more than just money here. We're talking about ideas and breakthroughs and life-saving medications, life-saving devices, all of these things that come out of NIH grants. And so, full disclosure, I work at Penn. Penn gets an indirect rate of about 63%. And, Penn is the fourth top institution in the country to receive NIH grants in 2023. These are all 2023 stats. Second most for graduate training grants. Penn Nursing is second most of schools of nursing, and Penn Medicine is third most in terms of the research grants they receive from NIH. So we obviously have a lot to lose here, but Penn also puts out a lot of breakthrough technologies around and medications and things around things such as combating cancer, or the mRNA technologies, gene editing tools, gene therapy cures, all of these things that have had such a major effect on the health of not just patients at Penn, but around the globe. And so when you start cutting NIH funding like this, it's going to really scale back these types of breakthroughs that researchers at Penn and at institutions all around the United States can really contribute to. And it's not just, folks at Penn and in blue states pushing back. There was an article out today from Politico and others about how red states are really having pushback as well. And universities in those red states are going to be hit really hard with these indirect rate cuts.
And actually, to your point, Marianne, I'll share part of the article that actually was featured on NBC News. I know you're going to share the political one, but among the top 20 states that take more money from federal government than they set in tax payments, 13 are solidly red states that voted for the current administration in the last three elections, according to the Rockefeller Institute's Government of Fiscal 2024. And the truth is what that means is that although we may think of NIH funding only going to elite schools in blue states like Penn or Harvard or UCLA, John Hopkins, things along this. Actually, we're hearing from a lot of our legislators in red states that are speaking that the University of Alabama, Louisiana, all of these state schools that have large dollars are going to possibly defund their greatest institutions, leading to significant instability in those local economies. Because what you don't also understand is that these NIH funding also support the infrastructure for a lot of people's jobs. And if these jobs go away, if this funding goes away, those jobs go away, and there is no place to rehire these jobs. So the downward impact of these fundings and also those partnerships of which those fundings actually do are risking a lot of not only jobs within communities, both red and blue states, but also all of the companies that have been hired in partnership with these NIH grants. Because in most situations, we actually see that these NIH grants fund public-private partnerships where private companies who employ individuals that benefit from some of those research now are at risk of going out of business as well. So this has incredible destabilizing one, not only from the impact you're talking about from ideas and actually solving really challenging problems, down to a really personal level that is going to impact potentially thousands, if not tens to hundreds of thousands of jobs across the United States.
And really, one of the most interesting things here is that there's no studies or clear evidence for the number of 15%. So cutting the indirect cost 15%, from the articles that I've read, there's no clear evidence for doing that. And so it just feels like it's some arbitrary number that the administration has come up with. Now,
well,
the
I think the
NIH
reason, sorry, Marion, just to say, I think the reason that they came up with that number, right, is that the goal was to actually strike about $4 billion from that budget, reducing it. And the way that they did that was looking at the percentage of administrative tasks to just drop that number in half. So they basically took the number of 30 as an average, went down to 15%, and said that translates from administrative costs about $4 billion in which we can save the American taxpayer. And I think to your point, there was no other study on it. It was purely a financial decision. This is an MBA program looking at an MBA guy coming in and saying, here's the easiest way to eliminate costs from the system, correct?
Yes, you took the words right out of my mouth. Yes, in 2023, the NIH said there was about $9 billion of the $35 billion for biomedical research that went to indirects. And so dropping it by almost half, gives you that 15%, but completely arbitrary. They could have picked any sort of percentage or number to drop it by.
And I think that why you and I are speaking out on this is, you've been a long, well-established researcher. And I, in the space of never being a researcher, though, recognizes that, my colleagues that spend their life researching, and they are the professors who spent half of their time in class teaching us and the other half of their class working on brilliant innovation, right? So if suddenly these research dollars go away, who is also going to be the professors in the classroom? Where are they going to go? How are we going to support these leading minds to stay and encourage them to stay and spend their time teaching? Because the truth is, the amount that is driven by tuition will never replace the dollars to keep these professors in a position where there is a financial amount that actually supports them to do both, right? And I think that's the concern, is that we think that enough tuition dollars is coming in, but the truth is, without federal grants, there's no way to actually pay for these professors to maintain the positions that they have to teach the next generation.
Well, and I think even more so, thinking about the patients across this country, thinking about the amount of research that happens around cancer, around diabetes, around Parkinson's, around cardiac arrest and heart disease. The amount of things that will not have the quality and quantity of research that needs to happen to help to decrease significant mortality and morbidity from these diseases and so many others. It's the American people who are going to suffer.
It
And,
is.
we're going to suffer on the health and healthcare side, but on the economic side as well. So, there's a lot that needs to be brought to the forefront so that people understand what it is we're speaking out against when we talk about having to push back against um, some of these things that the administration is pushing forward. Executive
And I
orders. That's the word I was looking for.
these executive orders that are coming out that are being challenged in the courts, as we know, the lawsuit that Marianne is referring to, actually only 22 of the 50 states signed on in this lawsuit to actually halt this. So we're really wondering what's going to happen in the course of the next week to see what happens. Because if this happens, every single university is going to have to make very difficult decisions, not next year, this year, how they're going to make up for that landfall and windfall. We understand that some of the biggest universities are facing cuts of nearly $250 million up to $300 million out of their budget overnight. With that loss of dollars, it means there is no way to sustain that. There's no gaps. Even those who have the largest endowments in the world, we're talking about Harvard and Stanford and Penn, those institutions do not have an endowment of 300 million shortfall to cover for the next 5 years. This puts not only these big institutions at risk financially, but it dramatically is going to dominate and devastate smaller institutions whose budgets have no endowments. And those dollars go away. We're looking at the closures of potential universities because of this. We're looking at the massive destabilization and then also driving down colleges from the size that they are today to a fraction of the size they are going to be in the future because these dollars don't exist. So not only are we destabilizing funding for breakthroughs in scientific research, we're destabilizing our entire education system at the college level by making these colleges happen. And we're hearing from the federal level, right, that Americans are already falling behind in the global discussion of education and where we're rating internationally on our understanding of math and science. What happens if we further destabilize our graduate and undergraduate education in universities across the country? I don't know how we're going to keep up with these kind of things. So I think that's why we wanted to have this conversation. But Marianne, what should people be thinking about? How should they be taking action? What should we be doing in this day and age about this if this is something people are interested in?
So I think we're going to have to sign off most of our Love and Leary podcast episodes in the coming weeks with this call to action. Do something. It doesn't matter what you do, just use your voice. Make phone calls to your local representatives and Congress people. Show up at their offices, show up at your senators' offices, send emails, sign petitions, join marches, post on social media, do all the things to help show that you are opposed to these cuts to indirect rates for biomedical research and to the NIH, and that this matters to you. Unless they know it matters to you, they will not move on their positions. And we need all of the senators, all of the representatives on both sides to really come together and prevent this from taking place.
Yes,
and that
I think we will.
comes from you.
Absolutely. I think we will want better fiscal responsibility. I think there are things that we can align on and how we do this.
Totally.
But cutting NIH grants and research is absolutely devastating, not only to the current environment around universities that is going to destabilize our entire higher education system, but more importantly, it's going to destabilize the entire future of the United States from the position that we have in this country. So get out there, make a phone call, write a letter. If this is an issue, if you're an academic, if you are married to someone who's working in a university, if you yourself are somebody who appreciated the degrees that you got from the university, university as you are, this is an issue that you should get behind and take action. We know we're not going to be able to take action on everything, but we should take action where we feel we have the best opportunities to do so. So again, Marion and I are here talking about these issues. We're going to be back with you guys in the future to talk about more of them. Perhaps we'll have an update in the course of the next week, but let's hope that if together we come together, we can actually do something about stabilizing what's happening with the National Institutes of Health and make sure that research dollars continue to flow to develop the next generation's cures. Thank you.